Good Saturday afternoon, everyone. Welcome to the Health Wrap.
Hello, Carolyn, and hello, everyone at home. We are excited that you have joined us this morning, and we have a lot to talk about. Carolyn, as we start to really get into the new year, a lot of people in a new presidential administration, a lot of people are saying, well, what's going to come up in the next 30 days? Because then it will become the 100th, day.
Yeah, we're coming up on 100 days, but there's already been a whole, as old people would say, heap of changes that have been made in the short period of time. I remember the first night in office as Biden had a stack of, I was about to say change orders like they talk about in the federal government, but they were actually executive orders reversing some things that had previously occurred. But it's been a busy couple months. Unfortunately, there still are some criticisms to how our country has dealt with COVID, how we've rolled out the vaccine, how we've attempted to make distribution of that vaccine equitable. The equitable question is coming back up again. I know I was fortunate enough with my parents to get my first shot, and I'm coming up on that second one. But again, there are so many that are wanting the shot and trying to figure out where they can get it, staying online all night long, trying to make appointments. And so we're really hoping that this sorts itself out. I think the last thing I heard, though, is that we could be talking fall before everybody has had a chance. We thought that might be summer before, maybe spring, but it looks like fall. And then I think I even heard the other day, and we've kind of been saying this, or I know we heard this, Karla, and that is we're still probably going to be having our challenges around COVID until the end of the year because of these new strands that we keep seeing from different parts of the country. But nevertheless, I worked with one of our team members, Brooklyn Gumby from Simmons College, and we put together an overview of what has happened thus far with the new Biden-Harris administration.
The Biden administration hit the ground running on a multifaceted pandemic relief plan that is part of their 7-goal national strategy to guide America out of the worst public health crisis in a century. As a result, we are seeing an increase in the COVID-19 vaccination locations. Whether it strikes your fancy to get vaccinated at Fenway Park or your local drugstore, there have been additional sites opened up in neighborhoods around the country. Need a ride? Lyft is working with the NAACP and other groups to give free rides for COVID essentials. But be sure to mask up. February 1st marked the start of federal travel mandates requiring masks on public transportation. Even with more testing sites and transportation options, Americans are still battling long waits in lines of cars. Gary Mattingly learned, after getting to the front of his line, no vaccines were available.
I've been waiting for several weeks to get my first vaccination, and the pharmacist here at Walmart is getting ready to stick me with the magic juice. It may hurt a little bit, but it's a good feeling to me because I know that I've waited a long time for this. And so he doesn't smile because he doesn't get paid to smile, he just gets paid to stick. So here we go. We're getting ready to get this shot.
Injectable Band-Aid.
Injectable Band-Aid. There you go. That's something new, so he doesn't have to put a Band-Aid on after the fact. Oh, that is cool. So here we go. And here comes the magic juice. Oh yeah, there it is.
Well done.
One down and one to go. Here we go. Thank you, sir. I appreciate that.
Extra vaccination sites come right on time as the market makes room for a brand new vaccine. Johnson & Johnson boasts a vaccine that differs from its competitors on more than just a molecular level. The company's vaccine division announced a single-dose delivery that is 85% effective against severe diseases. Moderna and Pfizer finished their clinical trials before more novel coronavirus strains from the UK and South Africa were confirmed, and Johnson & Johnson showed decreased effectiveness where new strands of the virus were found. While we wait for additional news on new protections, we still have frontline workers and qualifying students around the nation being vaccinated. Kalila Willingham, a physical therapy student from Simmons University, looked at some of the long-term outcomes of the disease when making her decision to get vaccinated.
Basically, for me, what it came down to was I've seen what COVID is doing to people. We've seen longer-term effects of that. they even now are coming out with studies showing how the like long-term lung scarring is impacting even people who are asymptomatic, or like the neurological complications that come along with that disease. And this vaccine is the best chance that I have to not take chances with something that could kill me, could kill other people, could leave me with like long-term morbidity. It's kind of like a risk assessment for me.
Biden signed an executive order in late January that extended the enrollment period for those in need of marketplace health insurance coverage. This healthcare covers Medicaid and CHIP on a state-by-state basis. The enrollment period began February 15th, 2021 and ends May 15th, 2021. To find out if you are eligible to take advantage of this special enrollment period, please visit healthcare.gov and either sign up or log in for more information.
So you can see a lot of changes in a lot of different areas, but I think all of these things combined, and that's what all the experts seem to say, will help us ultimately. And fortunately, too, we have seen in the last month a stabilization of some of the numbers that we've been watching. And I know they watch the numbers in terms of those that are hospitalized. Many of us are so fixated on the death rate, but we are seeing some stabilization, but still grave concerns about getting this under total control.
Absolutely. And when we come back, we're going to talk about what could happen and what's happening related to school. So just stay tuned and we'll be right back after this.
Did you know that you might need to get tested for COVID-19 more than once? If you're out and about in the community, DHEC recommends that you get tested at least once a month. Getting tested regularly helps diagnose those who may be asymptomatic and helps slow the spread of the virus. Learn more about how often you should get tested and how to find a testing location at scdhec.gov/COVID-19 testing.
As doctors, we know African Americans are more likely
to acquire and die from complications of the COVID-19 virus.
Why?
Because people of color suffer from higher rates of chronic medical conditions
like diabetes and obesity,
high blood pressure,
heart and kidney disease,
and asthma.
All of these lower our immune system and the ability to fight off viruses.
Being an essential worker and even using public transportation
increase the risk of getting COVID-19.
But we can better protect ourselves and others from the virus. Washing your hands,
not touching your face,
wearing a mask in public,
social distancing,
eating better, exercising, getting more sleep,
and visiting a primary care provider for health checks
will all make a difference.
If you have questions, call the number on the screen.
And visit our website.
Let's work together to save lives
and beat this pandemic.
We have layers of protection. We have layers of options, and the more that you use, the better protected you are. So it helps a great deal to wash your hands, because that prevents the spread of germs. Helps even more to wear a mask, because that helps us with what we call source control. These are diseases that are spread by respiratory droplets. So if we wear a mask, that prevents the spread of those droplets and prevents infecting other people. In addition to that, if we take advantage of the vaccine, we're building layers of protection. So any one of those alone offers some protection, but when you compile those and use all of the tools at our disposal, including the vaccine in particular, that's one of the most important tools, because the flu vaccine is the tool that we have to protect ourselves every year against getting a disease that can be fatal in some people.
The development and publication of this public service announcement was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. The contents are those of the South Carolina Primary Health Care Association and do not necessarily represent the official views of, nor endorsement by, HRSA, HHS, or the U.S. government.
We are going to talk about school and COVID-19. Carolyn, you know from the very beginning, this has been a fireball. It's been a fireball with parents, teachers, politicians, essential workers, people, the staff. People only a lot of times just think about the teachers, but you have bus drivers, you have other counselors, you have athletics, and especially about right now, this time of year, usually school districts are talking about balancing budgets for the upcoming year. But right now they're talking about battling the bug, and that's the COVID-19 virus and other things that come along with that. So the health of experts are saying that we need to phase in, and we've been phasing in the reentry. But right now, parents are hearing something that they haven't heard. Some parents, when can I go back to school? For some students, they do want to go back into the building, but it seems like the orders of the day change almost every day, and there's a lot of ins and outs that even the CDC is having to change. And a lot of students are worried about their scholarships, they're worried about their test scores, so students are wondering and parents are pondering, but for sure there are a lot of lessons to learn when it comes to continuing our education for our kids.
The doors of the schoolhouse continue to open in phases across the United States. In Chicago, after a bitter battle with the teachers union, the mayor greeted students and faculty on their first day of school.
We're getting the kind of assistance that can't be provided anywhere but through in-person learning. It reminds me, it's always about our children.
The next wave of teachers and families are studying school reentry plans. Educators are echoing a message about the uncertainty of safety. The United Teachers Los Angeles Union president says there is a health inequity when it comes to getting teachers vaccinated.
Teachers at a pricey private school in the Valley have been allowed to jump the line and get vaccinated. Yes, you heard me right.
California Governor Gavin Newsom recently announced that the state launched an online Safe Schools for All reopening map. It is interactive and it helps in making data-driven decisions to safely open classrooms and ensure public transparency.
Everybody would go back.
Ohio Governor Mike DeWine threatened to cut off COVID-19 vaccines to teachers and staff if schools did not commit to return in person, at least part-time. So teachers went ahead and got vaccinated. And then some school administrators, like those at Walnut Hill High in Cincinnati, said they are not going back. And that has upset the state government.
And it's the right thing to do. It's the fair thing to do. If you took the vaccine, to go honor that end of the commitment by serving those students.
The White House says it will defer to the CDC on reopening schools. President Biden says he wants schools to be open 5 days a week by the end of his first 100 days in office.
It's much easier to send kids K through 8 back because they are less likely to communicate the disease to somebody else.
The CDC says middle and high schools should be fully virtual in areas of high transmission.
I live with some at-risk people, and I don't want to risk going to school, catching something there from another student.
In Tennessee, honor student Michaela George had a hard decision to make as a senior.
And I just wanted her to be able to experience that excitement about completing high school and preparing for the next phase of her educational journey.
Obviously, I want to be back in school with my friends and see teachers and have fun, but that's not the school system we would be having right now. It'll be very just different.
You used to be able to just go outside and play with your friends and get in the school bus and go to school and everything was normal. And now when things change, people get really worried and scared. But don't be scared, honey. Don't be scared. You're going to be fine. And we're going to make sure mommy's fine too.
I think he could be called the comforter in chief as well, Karla.
You took the words right out of my mouth. When I saw that, it just did something to me. And of course, President Biden has a great interest in education. His wife, Dr. Jill Biden, is an educator. He's also said that we may be looking at possibly going to summer school. I know Atlanta already is addressing that. And what they're trying to figure out is if they can mandate it. So they're talking to attorneys and talking to people in the district to see that. I know as an educator myself, last year we had school, but it was not mandatory, but it was strongly suggested that you attend it.
Well, as a product of Atlanta Public Schools, I went to summer school every summer. Yes, a little geeky, but that's okay. It's good to learn lifelong, not just 9 months of the year, but all of your life.
Absolutely. Well, when we talk about learning, part of learning and getting mature, that's one of the things that people are very, doctors and educators and are concerned about the mental health also of not only just the students, but also the faculty and the teachers and other providers at the school. We're seeing every day stories about people who are having issues with social interaction, the lack of it. We're seeing kids in front of screens all day, and some of them into tears and just frustrated, especially younger children. And some of the older children, unfortunately, have taken their lives. But there's no technology that can replace that human touch and being in person with someone. So a lot of people are having some challenges. And so since we are Docs on Call, we talked to Dr. Sherry to how can you manage this madness going back to school inside the four walls, or if you're at home until the end of the year.
If you have to go back, I want you to understand 3 things, maybe 4 things. But the first thing is you got to be okay with not being okay. This is something that's not within your control. 2, you're going to control those things you can. So washing your hands, making sure you have a mask on. If you are a teacher, making sure the kids have a mask on. It is not very realistic, and we all know that we're going to be 6 feet apart in a classroom. That's not realistic unless you only have a handful of children, and I'm not sure how that's going to work out now. But the reality is that you can only do so much, so you're going to control those things that you can control. The other thing is have a plan. What happens if you do get sick? What happens if someone in the classroom gets sick? Do you have protocol to trace that back? If you get sick, do you have someone to take care of your children if you have them while you isolate? How do you handle all of this? And the thing is, there's no perfect plan because there's no roadmap. This is the first time I can remember we're doing things as we go along, and we're hoping that it works. The last thing I want to make sure you understand, regardless of how stressful things are, and again, I'm not just talking about the children, I'm talking about for parents, teachers, administrators, second, it doesn't matter, anyone involved in the school system. Remember, you're not alone, you're not in this by yourself, and you have to stop and take care of yourself. And taking care of yourself, you say, well, I'm just not going. Well, if that's your job and you have no choice and you don't have that option, how do you take care of yourself in the midst of a crisis? You do what you can do. You remember that at times you may need a break. You may need to go out and just give yourself a nice little short walk. Walk in nature. Clear your head, meditate, maybe you need to pray, but also you need to be very alert and be very aware if you do start having symptoms or if somebody else has symptoms around you. Again, this is all new for all of us. So I want you to understand your stress, your anxiety is going to be very, very normal in situations like this. Try to minimize them as best you can by understanding you're not alone. This is Dr. Sherry. So glad I could join you. And of course, you can always join me at any time at Ask Dr. Sherry or go to my website, www.askdrsherry.com.
Some good advice. Great advice.
Yes, absolutely. And we're going to have some more information for you throughout the year related to mental health. That is something that we're championing. And especially now, you have to champion mental health because everybody is affected. I mean, your paper boy, your doctor, your lawyer, your spouse, your friend, your brother, everybody is affected by this pandemic now that we've been in it so long. So it can be very stressful for a lot of people.
Well, when we come back, we're going to look a little closer at how things, it's just things we might take for granted on a daily basis have changed in this last year. What effect COVID has had on your daily task and duties. Stay with us.
Whether it's advice on managing your anxiety or tools to help you stay grounded, Coping-19 provides a range of resources and self-care tips to help you cope with this pandemic. We can help. Find the resources that work best for you at coping-19.org.
Even though there is so much against us,
you will see me choose to protect myself and my community from the coronavirus by wearing a face covering.
Because it's going to take all of us thinking about one another.
And even with my face covered, you will see me.
You will see me as a mother, a wife, a friend.
As an athlete who gave everything to the game I love.
As a father, leading by example.
As a sister.
An entertainer.
As a champion for my people.
You will see me finding a light in a dark time.
To unlock our creativity and push our craft.
You will see me demanding the space to tell the stories that matter.
As a man who knows that tough times don't last, but tough people do.
Join us in wearing a face covering to help stop the spread of the coronavirus.
Because covering your face is one small act of kindness that has the power to bring us together.
Everyone copes with stress differently. Take steps to protect your mental and emotional health. Take breaks from news and social media. Eat healthy, well-balanced meals and exercise regularly. Find the time to relax and participate in activities you enjoy. Talk to someone you trust about how you're feeling. Find the balance that works for you.
We have had during this time of quarantine what so many of us are calling the new normal, and that we're not likely to go back to the old days, as a lot of people refer to them. I know with us and New Year's, a lot of us have always stayed home. Most of us were home this year because of the quarantine. But we had an opportunity through one of our Simmons student team members to take a look at how the Chinese New Year had a different spin to it as well. Here's Nicole.
Hi everybody, my name is Nicole and I'm an intern at docsoncall. I'm going to take you guys along with me to show you how my 2021 Lunar New Year is different from 2020's Lunar New Year. So let's start off by saying, Happy Lunar New Year everybody! Gung hei fa choi! This is a time to wish upon good health, prosperity, and love for one another. I have a big family, so last year's Chinese New Year looked a lot different from this year because I was able to spend it with my whole entire family. But with COVID, this year has been limited to just my immediate family. Usually, my family would host a big end-of-the-year dinner to close off the year, but that tradition had to change. Also, there's an opening dinner that my mom and dad's families usually plan to wish each other good health and fortune, but sadly, I am unable to see them this year. But my family likes to spend their quality time by playing mahjong together. Even though COVID has stopped my family and I from seeing each other, my mom likes to keep some traditions and keep the festivities alive. Every year, we decorate the house with red and traditional scrolls. The color red symbolizes good health and luck, so we like to spread it across the house. COVID has made it difficult for my mother to shop for the new year because of the high demand of certain Chinese dishes. Since everyone is shopping at the same time and for the same things, my mom found it hard to shop because she wants to stay safe while trying to find the ingredients for the dishes. Also, during this time, there have been growing concerns for the Asian community because of the attacks happening all over the US due to anti-Asian racism connected to the coronavirus. So I hope everyone has a great rest of the year and please stay safe.
So
now,
Carolyn,
Nicole said they were going to be throwing down. She didn't tell me they'd be throwing down like that.
Carolyn, so when the pandemic is over, I think that we need to make up for the new year.
We're going to invite
have a
ourselves
whole
up
big
to
old
Boston.
spread.
We're just going to invite ourselves up. Okay.
We're
We'll
just
let
show
Nicole
up.
know. We're coming next year. Tell your mama.
Show enough.
I love it. I love it. I love it. Well, she alluded in the piece, Karla, to the fact that in some instances they weren't able to go out and find some of the things that they normally had in the store. And I know our producer, Rashonda, has been talking to us about just the changes in prices, supply, so many things that are right in front of you. And she took an opportunity to work with one of our student from Simmons as well to tell us about what's happening all around us that you might not have even noticed.
Global food prices reached a 6-year high in December, and according to Bloomberg reports, will likely keep rising into 2021. This time last year, retail grocery prices spiked 2.6% from March until April 2020, according to the U.S. Bureau of Labor Statistics. From food to exercise and overall health, COVID-19 is having a huge impact. How do you stay healthy in the middle of a pandemic? You can keep costs down by shopping low-cost alternatives. For example, try a meatless meal like chili with beans instead of beef. If fresh fruits and veggies are too costly, consider plain frozen vegetables and fruit. Experts recommend eating healthy, well-balanced meals. Plan ahead by visualizing your meals and stock up on nutrition that will stay fresh for a week or longer, such as bread, grains, and beans. COVID-19 closures of parks, gyms, and fitness studios are making it harder to exercise. However, exercise is important to maintain health, prevent weight gain, reduce stress, anxiety, and improve sleep. The World Health Organization recommends 150 minutes of physical activity per week. Here are a few tips to stay active and reduce sedentary behavior. Take advantage of an online exercise class. Many of these are free and can be found on YouTube. If you have no experience performing these exercises, be cautious. Go for a walk. Walking around or walking on the spot can help you remain active. Take a stand. Stand up whenever possible. The aim is to interrupt sitting and reclining time every 30 minutes. Relax. Take deep breaths, stretch, or meditate. The risk for severe illness from COVID-19 is based upon pre-existing condition, according to doctors. One way to combat that is with regular checkups. We spoke to Dr. Karla Frazier, a dentist in Austin, Texas, who says she understands people are afraid about coming into the office for routine checkups, but this is not the time to neglect your oral health.
Brushing your teeth once a week is like not taking a shower. It creates an environment in your mouth that will promote decay and gum disease and possibly other issues. And not brushing your teeth is just going to lead to your teeth becoming more decayed, more sensitive, gum deterioration, and basically your teeth breaking and falling out.
There is one thing we've learned through this. Our health is our wealth. Be a good steward. For Docs on Call, Hannah Chestnut.
Absolutely not the time to neglect those teeth. You need that smile. You're going to need that smile when the quarantine ends and you can take the mask down. Everybody is kind of getting away with, hiding expressions behind the mask. But when we have to take those masks off, you're going to need that smile.
Yeah, that's one of the things Dr. Frazier said. She said that a lot of people were like, oh, I just brush my teeth. Like, I'm just not changing my clothes. I'm just in for the pandemic. I may brush my teeth every once a week. What? She's like stunned that people are doing that. And it leads to other things like heart disease, the bacteria. Absolutely. So Dr. Frazier was concerned about that.
Some great advice. Thanks to Hannah and Rashonda for putting together that great piece. That was wonderful. It's been a great show. Lots of good information. Of course, we'll be back next month. But until then, you got some show ideas, you want to reach out to us, you can find us on Facebook, Docs on Call. You can also find us on the other platforms as well. We'd love to hear from you and hear what your thoughts are or ideals might be around health disparities, COVID, as we address that here on Docs on Call.
And share our show. We love when you share our show and you send us comments. So, Carolyn, I guess we're going to go and then we'll see everybody next month.
Until the next time, have a great, great day. Bye.
Docs on Call is proud to partner with the W.K. Kellogg Foundation, Gwen Ifill College of Media, Arts, and Humanities at Simmons University, along with the School of Social Work, the Program in Public Health, and the President's Advisory Council on Diversity, Equality, and Inclusion.